Today we're diving into facial aesthetics,
Mm-hmm.
specifically how surgeons analyze faces for potential enhancements.
Okay.
We'll be using excerpts from a surgical textbook, so it'll
Uh-huh.
be like getting a glimpse into how the pros think.
I like it.
We always hear about those golden ratios
Yeah.
and perfect proportions when it comes to beauty.
Right.
But what do they really mean from a surgical point of view?
Well, I think that's a great place to start. It all begins with the skin.
Oh,
The
yeah.
skin is like the foundation for any procedure.
So healthy skin is key.
Absolutely. You can't build a beautiful house on a shaky foundation.
Makes sense.
Yeah.
So how do surgeons actually assess skin health?
Well, they use classification systems to evaluate skin type and the degree of aging.
Okay.
One is the Fitzpatrick skin type classification.
Fitzpatrick.
It categorizes skin based on its reaction to sun exposure.
So how it reacts to the sun.
Exactly, and that helps surgeons predict how the skin will respond to treatments.
So someone with fair skin who burns easily would be treated differently than someone with darker skin.
Exactly. It's about tailoring the approach to the individual skin.
Got it.
Another important one is the GLOGO classification.
Clogo,
This one focuses on photoaging.
which is sun damage.
Essentially, yes. It helps surgeons understand the severity of wrinkles, sunspots, and other signs of aging.
So it guides decisions about rejuvenation.
Precisely.
Interesting. So these classifications provide a roadmap
You could say that.
to navigate the complexities of skin health.
Yeah.
But let's move on to those divine proportions you mentioned earlier. How do surgeons use measurements and ratios?
Right. Well, one of the foundational concepts is the neoclassical canons.
Yeah, classical canons.
These are guidelines based on ancient Greek ideals of beauty.
Okay.
They involve dividing the face into specific sections and analyzing the relationships between those sections.
Okay.
For example, the head can be divided into equal halves by a line through the eyes,
Equal halves.
demonstrating balance. The distance between the eyes should ideally be the width of one eye, illustrating symmetry.
I see.
The head can be divided into equal thirds, with the nose taking up the middle third.
Okay.
It also states that the head can be divided into equal quarters, with the forehead and nose being the middle 2/4.
Okay.
The length of the ear should be equal to the length of the nose.
And about fifths.
Additionally, the face can be divided into equal fifths, each being the width of one eye. The mouth width should be 1.5 times the width of the nose.
Interesting.
Finally, the lower face can be divided into equal thirds and equal quarters as well.
So these proportions are like a puzzle.
Yes, each piece fitting together to create a harmonious picture.
These are really fascinating insights. But these are guidelines, not strict rules, right?
Of course, of course. Every face is unique, and the goal is to enhance natural beauty.
Not create uniformity.
Right. The art of facial aesthetics lies in balancing these guidelines with the individual's unique features.
And desired outcomes. Speaking of analysis, surgeons don't just look at a face head on, do they?
No, they analyze faces from multiple angles to get a comprehensive understanding.
Uh-huh.
The frontal and lateral views are particularly important.
Frontal and lateral.
In the frontal view, they use the concepts of vertical fifths
Okay.
and horizontal thirds
Okay.
to guide their analysis.
So can you elaborate on those concepts a bit?
Sure. Imagine drawing vertical lines at the outer edges of the head, the outer corners of the eyes, and the inner corners of the eyes.
Right.
This divides the face into 5 equal vertical sections.
Gotcha.
For horizontal thirds, imagine lines drawn at the hairline, eyebrows, base of the nose, and chin.
Okay.
This divides the face horizontally into 3 equal sections.
So it's like creating a grid system.
Yes, exactly.
What insights do surgeons gain from this?
Well, this grid helps them assess the proportions
Okay.
and relationships between different facial features.
Uh-huh.
For example, they can determine if the width of the mouth is proportionate to the distance between the inner corners of the eyes.
I see.
Or they can check if the width of the face at the cheekbones is roughly equal to the distance from the eyebrows to the chin.
It's about understanding how all the pieces fit together.
Right.
Now, what about the lateral view?
Yes. The lateral view, or profile, reveals the balance and projection of facial features.
Okay.
They pay close attention to the lip-chin relationship.
The lip-chin relationship.
Ideally, the upper lip should project slightly more than the lower lip,
Okay.
creating a pleasing contour. They also analyze how the lower third of the face is divided,
Right.
which helps them assess the chin and jawline.
So they're building a three-dimensional understanding of the face.
Precisely. They consider each region of the face, forehead, eyes, nose, mouth, chin, and neck, and analyze its specific aesthetic considerations.
Okay, so starting with the forehead and brows.
The brows are incredibly
I
important.
frame the eyes.
Absolutely. Surgeons carefully evaluate brow position because it influences the overall appearance of the eyes. They check for signs of brow ptosis.
Which is drooping of the brows.
Yes, and assess the ideal ratio between the brow and the lash line.
Okay.
This ratio often reflects the golden ratio, which is approximately 1 to 1.618.
That golden ratio keeps coming up.
It's a fascinating concept that appears in various aspects of beauty and design. Now, moving on to the upper eyelids, which are a delicate and crucial area.
What are the key things surgeons focus on when examining the upper eyelids?
They assess for excess skin, fat herniation, which causes puffiness,
Uh-huh.
and the overall position of the lid.
Okay.
They also pay attention to something called pretarsal show. Imagine the eyelid as a stage curtain. Pretarsal show is the amount of that curtain visible below the crease.
So pretarsal show refers to the amount of visible eyelid below the crease. Why is this important?
The amount of pretarsal show contributes to the overall appearance and balance of the eyes. Too much or too little can throw off the harmony of the eye area.
Makes sense. Then we have the lower eyelids, which are often a concern for patients.
Yes, under eye bags and dark circles are common complaints.
What do surgeons look for when assessing the lower eyelids?
They assess for under eye bags, which are caused by fat protrusions,
Okay.
and tear trough deformities, which are hollows or depressions under the eyes.
Got it.
They also look for something called scleral show, where too much of the white part of the eye is visible.
So they're meticulously analyzing every aspect of the eye area.
They are. The eyes are a central feature of the face, and even subtle changes can have a significant impact on overall appearance. Now, let's move on to the nose.
The nose, the central feature of the face. I imagine there's a lot to consider when analyzing the nose.
There is. It's a very intricate analysis. They begin by considering skin type, because it affects healing and how the skin drapes over the underlying nasal structure.
So someone with thicker skin might heal differently than someone with thinner skin after rhinoplasty.
Exactly. Skin thickness is a key factor in surgical planning and predicting outcomes. They also assess for any nasal deviation.
Which means if the nose is off-center.
Yes, this can impact facial harmony and breathing. Then there's tip projection, which refers to how far the tip of the nose projects outward,
Okay.
and rotation,
Oh,
which determines if the nose looks turned up or droopy.
I see.
And of course, they consider the nasolabial angle,
Which is,
the angle between the nose and the upper lip.
wow, it's amazing how many factors go into analyzing just the nose alone.
It's a complex structure with a significant impact on facial appearance.
For sure.
And it's important to remember that there are ethnic variations in nasal structure.
Right.
So surgeons need to tailor their approach to each individual's ethnicity and desired outcome.
Makes sense. Now let's move down the face to the mouth and lips. What are the key considerations when assessing the mouth and lips?
They evaluate lip volume, the definition of the vermilion border.
For vermilion border.
That's the line between the lip and the skin. And the balance between upper and lower lip projection. They also look at perioral lines.
Those are the fine wrinkles
Sure.
around the mouth.
Yes, and how aging affects the corners of the mouth.
Downturned mouth corners can definitely contribute to an aged appearance.
Yes, they can. Finally, we reach the chin, which plays a bigger role in facial balance than many people realize.
So it's not just about having a strong jawline.
Chin projection is very important for overall facial harmony. They use something called Rydell's plane to assess chin position relative to the lips, ensuring it's in balance with the rest of the face.
This entire process is incredibly detailed. It really highlights the level of precision involved in facial aesthetic analysis.
Absolutely. Surgeons approach facial analysis with meticulous attention to detail, considering every nuance of each facial feature and how they relate to one another. And we can't forget about the neck.
The neck, right?
It's often overlooked, but it has a huge impact on overall facial appearance.
A youthful contoured neck can definitely make someone look years younger.
Precisely. Surgeons evaluate skin quality, platysmal banding, those vertical neck cords that can develop with age, and the definition of the jawline.
Okay.
They strive to create a smooth, elegant transition from the face to the neck.
Yeah, it's amazing, isn't it, how interconnected all these elements are.
It really is.
From the skin to the individual features to the overall harmony of the face.
No, it's like an intricate symphony, each instrument playing its part
I like that analogy.
to create a harmonious whole. So, having explored all these details, can we say that facial aesthetics is a perfect blend of art and
I
science?
think so. It's about combining those objective measurements and scientific principles with subjective aesthetic judgment.
And then artistic vision.
Exactly.
Yep.
Surgeons use these guidelines and classifications as tools, but they also rely on their experience and expertise.
To create individualized treatment plans for each patient.
Precisely.
So they're not just applying a formulaic
Yeah,
approach,
not at all.
but rather tailoring their techniques to each patient's unique features and goals. Exactly. And patient communication is crucial in this process as well.
So they really need to understand their patient's desires.
They do. They need to assess their facial anatomy and then create a plan that aligns with realistic outcomes.
It's a collaborative process,
Absolutely.
ensuring that the patient's expectations are met with achievable results. And it's important to remember that these guidelines are not meant to create cookie-cutter beauty.
No, of course not.
They're tools to help us understand the complexities of facial aesthetics
Mhm.
and appreciate the nuances of beauty in all its forms.
Well said. These guidelines provide a framework for analysis, but they don't define beauty.
Right.
Beauty is subjective,
Yeah.
and it's influenced by cultural norms, personal preferences, and individual perceptions.
That's a really important point. Thinking about all this meticulous analysis, it makes you wonder about the beauty standards and trends we see in the media and online.
Yeah.
Knowing what we now know about the complexity of facial aesthetics, how do you think this deep dive might shift our perception of those trends?
It's a good question. Perhaps it encourages a more critical and discerning perspective.
Okay.
We start to see beyond the filtered images and recognize that true beauty lies in the unique combination of features that make each individual special.
It's about appreciating the diversity of beauty rather than striving for a single unattainable ideal.
Exactly. This deep dive has really only scratched the surface of facial aesthetics.
Right. There's so much more to explore.
From the intricacies of facial anatomy to the advancements in surgical techniques and non-surgical options.
This exploration has definitely sparked a deeper curiosity in me.
Yeah.
I'm starting to see faces in a whole new light, appreciating the subtle details and the intricate interplay of features.
That's the beauty of knowledge, isn't it?
It is.
It opens up new ways of seeing and understanding the world around us.
In this case, it allows us to appreciate the art and science of facial aesthetics with a more informed and discerning eye. Yeah, it's fascinating to think about.
It really is.
Something as simple as a glance at a face
Right.
actually involves such a complex interplay of factors. This knowledge really changes how you see beauty in everyday life.
It does, doesn't it? And it emphasizes that achieving aesthetically pleasing results isn't about chasing fads, but about a deep understanding of these underlying principles.
Right. It seems like a field where continuous learning is essential,
Absolutely.
especially with new research and techniques emerging all the time.
Absolutely. And that's what makes it so exciting. This deep dive has only scratched the surface. There's a whole world of knowledge out there about facial anatomy, aging processes, surgical techniques, and non-surgical advancements. It's a constantly evolving field.
It sounds like a field that requires not only technical skill, but also a keen eye for aesthetics and an appreciation for the individuality of each patient.
You've hit the nail on the head. It's about blending the precision of science with the artistry of aesthetics, all while respecting the unique features and desires of each individual.
Well, I think we've successfully navigated the fascinating world of facial aesthetics with this deep dive. We've uncovered the tools and techniques surgeons use to analyze faces, explored the concepts of proportions and harmony, and gained a deeper understanding of the interplay between art and science in this field.
It's been a pleasure delving into these intricacies with you. Hopefully, our listeners now have a newfound appreciation for the complexity and beauty of the human face.
And perhaps this knowledge will inspire some to continue exploring this fascinating field, whether professionally or simply for a deeper understanding of the faces we see every day.
Remember, beauty is more than skin deep. It's about the harmonious blend of features, the subtle interplay of light and shadow, and the unique characteristics that make each individual captivating.
Until next time, keep diving deep.